Good evening. I'm Induja, PhD scholar in Department of Biochemistry, MGMCRA, Puducherry. Today, I'm going to present my topic entitled on altered VEGF and neurobiomarker expression in levothyroxine treat hypothyroidisms. Background information of my study is thyroid hormone has various physiological functions, including the wound healings. Hypothyroidism can lead to neurological manifestations and often requiring treatment with levothyroxines. Neuron-specific enolase and the serum calcium binding protein B is commonly used brain injury markers, and vascular endothelial growth factor is essential for new blood vessels formation and tissue repair after brain injuries. This image, this image shows the mechanism of thyroid action, thyroid action in promoting the recovery after brain injuries. And this image is believed that thyroid hormone treatment of post-traumatic brain injury has promoted the neurogenesis. Aim of my study is to assess and correlate the serum levels of vascular endothelial growth factor with brain injury markers such as NSE and S100B in hypothyroidism, which could help the personalized thyroid hormone replacement therapies and improved outcomes for individuals with hypothyroidism. Objective of my study is to assess the serum angiogenic and neurobiomarkers in hypothyroidism subjects treated with levothyroxine compared to the control subjects to demonstrate the genetic expression of angiogenic and neurobiomarker genes in leukocytes of the hypothyroid subjects to control subjects to correlate the angiogenic markers with neurobiomarkers in the hypothyroid study subjects. Understand, moving to the subjects and materials, study participants or cross-section study. It involves a hypothyroid and control subjects visiting MCMCRA for treatment. Ethical consideration, it is approved by IRC and IHEC and it is obtained after obtaining informed consent from the participant. The study group involves group A is healthy control and group B is hypothyroidism. Studies are coming to the sample collection and processing. We are collecting total 5 ml of samples. In the 3 ml of sample is used for isolation of the PBMC for gene expressions such as VEGF, NSE, and S100B, and it is analyzed using a RT-PCR method. And remaining 2 ml of serum sample is used for biochemical investigations such as diabetic profile, thyroid profile, and renal profiles, and it is analyzed using a CLIA method. And we are also further collecting the demographic details of the patient's age, dose, and duration of the drug. In the duration of the drug, the patients who are taking levothyroxine more than 5 years are recruited in the studies. And moving to the statistical analysis, statistical analysis is done. Approximate statistical analysis done by using SPSS software 90, and p-value is less than 0.95. Not 5 is considered as statistically significant. And moving to the results, assessment of result 1, assessment of the blood biomarkers in hypothyroidism compared to the control. In table 1A shows the serum biomarkers in hypothyroidism compared to the controls. In this table 1, thyroid profile values are significantly altered between the groups, and there is no significant change observed between the diabetic profile and renal profile between these both groups. In table 1B shows the serum biomarkers when compared to the hypothyroidism when compared to the control. In this uh, VEGF value and serum VEGF value NSE and S100B values are decreased in hypothyroidism when compared to the control. In table 1C shows the age, dose, and duration of the drug in hypothyroidisms. Moving to the result 2, in the figure 1A shows in a gene expression of VEGF. VEGF is decreased in hypothyroidism in compared to the control. Moving to the figure 2, 1B, in this, there is no significant change observed in NSC gene NSC gene in between this both the groups. There is no in figure 1C S100B gene, there is no significant change observed between these groups. This is the images show the data analysis of the RT-PCR. Moving to the result 3, figure 2. There is this is a result shows the correlation between the VEGF NSE and the S100B. In this figure 2A, VEGF, there is a positive correlation between the VEGF A and S100B, and figure 2B, there is a positive correlation between the VEGF A and NSE. Moving to the result for figure 3. Figure 3 shows the ROC curve carried out for the serum biomarkers for prediction of neurodegeneration in hypothyroidism. However, the sensitivity there is a less sensitivity and specificity in predicting the neurodegeneration could be due to the other confounding factors that need to be addressed. Then moving to the discussion, a chronic hypothyroidism impaired with brain functions, which when treated with levothyroxine, with may prevent the brain damage. In our discussion, in our study, we found a decrease in VEGF level, S100B and NSE, and also we found a positive correlation between the VEGF-A and neurobiomarkers. In hypothyroidism, decrease thyroid hormone synthesis and functions, the neuro may prevent the neuroendocrine dysfunctions. Levothyroxine treatment restores the thyroid functions, induces the VEGF-A expressions and neuroprotective effects. And also, decrease the NSE and S100B levels may reflect the possibility of delayed neuro regenerations and incomplete recovery of the metabolic and synaptic functions. Decrease and but also similarly, decrease VEGF-A also VEGF-A might ineffective of reflect in the ineffective of thyroid hormone actions in neural injuries. These are the key findings and conclusion. Despite levothyroxine treatment, hypothyroid levels did not significantly correlate with VEGF-A, suggesting other regulatory factors. And these findings highlight the need to explore the additional mechanism affecting neuroprotection in the hypothyroidism to prevent long-term neurological manifestations. These are the references. Thank you.